Abcede from Davao Doctors College, and today I am going to perform the return demonstration for Leopold'S maneuver. Leopold'S maneuver is a systemic palpation of the abdomen for pregnant. This is used to assess the fetal presentation and the fetal position, and also to determine the fetal presentation in the uterus and the fetal position expected during labor and delivery. First procedure, wash your hands. This is to deter the spread of the microorganism. Second procedure, explain to the clients what you are going to do for the procedure. This is to gain the patient's cooperation. Next procedure, provides for client's privacy. This is to ensure the client's comfort. So now, ma'am, I'm going first to lock the window and our door for us to have a privacy in our procedure. Is that okay, ma'am? Okay, thank you po. Next procedure, let the patient empty her bladder before going to the procedure. This is because distended bladder may slightly deviate the uterus. Position the client into a supine position with a pillow in the head and the knees are flexed. This is to facilitate accurate assessment, and knee flex are relieve the tension of the abdominal musculature. Place a rolled towel under the client's right hip. This is to shift the uterus away from large blood vessel and to prevent supine hypotensive syndrome. Now, ma'am, I'm going to put first a rolled towel under your right hip. Okay lang ba yun, ma'am? Okay, thank you po. Now, let's proceed to the first maneuver. The first maneuver is the fundal grip. This is to determine whether the fetal head or buttocks are in the fundus. Face the patient and palpates the uterine fundus to determine what part of fetal lies in the upper part of the uterine fundus. The head characters round and hard, movable, and ballotable, while if it is breech, it is soft and nodular. So, ma'am, upon my assessment to your abdomen, your baby's presentations are in a cephalic presentation because as I palpate your fundus, the buttocks of your baby is what I felt. I know it is a buttocks because it feels soft and nodular. If it is a head, it will be round and freely movable, but it is not. So therefore, it is your baby's buttocks here in your fundus. So to perform this, palpate in a downward direction in the side of the abdomen, applying a soft but a deep pressure to determine the fetal extremities, fetal back, and anterior shoulder of the fetal. So, ma'am, upon my assessment, your baby's back are in your right lower quadrant because when I palpate it I feel a long, continuous structure. So, therefore, it is your baby's back. Now, the third maneuver is what we call Paulick's grip. This is to determine the presenting part and if engagement has occurred. Place one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and your fingers to feel the presenting part. So, ma'am, in my third maneuver, upon my assessment, your baby is now already in engaged station. It is now in a zero station because it is not movable Therefore, it is engaged already. Next procedure, turn the face of the woman's feet to confirm the third maneuver and to determine the flexion and the vertex. Move fingers of both hands gently down to the side of the abdomen towards the pubis. So after palpation, locate again for the back of the fetus and place the stethoscope over it and listen for fetal heart rate for 1 full minute. So ma'am, upon my assessment, your fetal heart rate is in 130 beats per minute. It is in a range of a normal fetal heart rate. So after the palpation and locating the fetal heart rate, let's now note the location, the character, the rate of the fetal heart rate. So upon my assessment, the fetal heart rate is 130 beats per minute in a cephalic presentation. And I heard the fetal heart rate in the right lower quadrant. But if the baby is in a bridge position, you can hear its fetal heart rate above or in the level of umbilicus, either right or left. And the baby's fetal heart rate is normal without any abnormalities present. After that, make the patients comfortable to ease and promote relaxation. So ma'am, I'm already done with my assessment. You can now relax. And thank you for your cooperation. So, after all the process, we will now documenting all the observations made. The fetal heart rate, the presentation, the location, attitude, whether it is engaged or in a floating. So the rationale for that is to promote database in the future. So, upon my assessment, the fetal presentations of my client is in a cephalic presentation as well as fetal heart rate 130 beats per minute normal with no signs of abnormalities and already in an engaged station.